How much tesamorelin should I take for weight loss? This is a question that gets asked a lot. I'm Regan Archibald, founder of East West Health, and the author of The Peptide Blueprint, which is a book that you can download and learn about all the great peptides that are out there, including tesamorelin. But tesamorelin, if you're wondering on the dosing, if you take too little tesamorelin, then you're not going to get the fat burning effects. If you take too much, you're not going to really benefit outside of the fact that you're overdoing it and your body will just not use what it can't and get rid of it. So there's a real strategic way to do this, and in this video I'm going to show you exactly how to take tesamorelin, how to dose it, and what is going to be the most effective way of using it for burning off that stubborn fat. So tesamorelin, what is it? Well, this is a chain of amino acids, and these chains, these little peptide molecules, are folded in a very particular way that activate the growth hormone release from your hypothalamic pituitary axis. And the beautiful thing about tesamorelin is it's a peptide that was FDA approved in 2010 for patients who were HIV patients, and they started to develop all this adiposity around their organs in their belly. And so this is known as visceral fat. And many of you probably know that visceral fat is the kind of fat that you don't want hanging around because it's inflammatory and it almost hijacks your metabolic system because it signals all these inflammatory markers and your body feels more tired. You don't sleep great. The dangerous thing about visceral fat is not only the body composition, but it does start damaging the arteries because you have higher levels of triglycerides. You'll notice your cholesterol profile gets out of balance, and then you'll start putting yourself at greater risk of strokes and high blood pressure and cardiovascular disease. So with tesamorelin, the thing that is great about this peptide is they noticed that as these patients who were in the clinical studies, in the phase 3 clinical trials, what they found is that patients using the tesamorelin, they actually had a reduction of visceral fat in a dramatic way. And what they did is these patients were taking 2 milligrams daily of tesamorelin. In some cases, they would go 2 years on tesamorelin, and the safety profile was very positive. They found that patients had anything outside of some bruising at the injection site, but they noticed that these patients with HIV, instead of having their muscles waste away and gaining, bigger and bigger bellies, they found that the belly fat started to shrink, and they were actually able to gain muscle. So when you're taking tesamorelin, the dosing is really important. The frequency is really important. And when we're looking outside of a clinical trial, if your doctor's prescribed this as, maybe an off-label use, maybe you're just looking to enhance your muscle while losing belly fat, then you can go down to a dose that's more like 1.4 milligrams and do that 4 or 5 times a week based on what your medical provider prescribes. Just read the instructions. And what you'll do is you'll use this peptide in a fasted state. So one of the ways you can stop the release of the growth hormone is having high levels of insulin. And so if you've eaten a bunch of food, like you've eaten a bunch of carbs, and you go and inject tesamorelin, well, you're not going to get the same benefits as if you wait about 90 minutes after eating to inject tesamorelin. And so the ideal time to do this is, ideally about 30 minutes before you go to sleep. And when you do it at night, one of the best things is if you can get to bed by around 9:30, follow the 3-2-1 method of sleeping. And if you don't know what this is, that's 3 hours before you go to bed, stop eating. 2 hours before you go to bed, stop drinking fluids. And then an hour before you go to bed, that's the time where you really want to start focusing on all the stressful things in life. So watch CNN, Fox, no, joking. That hour before you go to bed is the time to just relax. Dim the lights, read a book, and then it's also a great time to take your peptides. So follow the 3-2-1 method. Tesamorelin, best to use right before bed, about 30 minutes before bed. If for some reason peptides are, they may stimulate you a little bit, then take it first thing in the morning, right when you wake up, when you're still in a fasted state. and use the peptide, tesamorelin, and then wait about 30 minutes before you eat. And that's the other great time to take it. I find that at night, it's easier for me to forget, and so I do generally like to do my peptides in the morning. And I do most of my peptides in a fasted state. The ones that really matter are like tesamorelin, because this is a peptide that is very powerful and works best in a fasted state. So take a real quick quiz here and just see if tesamorelin is right for you. Because tesamorelin, there's a lot of studies, and my next video, we're gonna go deep into what these studies show and what tesamorelin can do on multiple levels. But first, is tesamorelin right for your weight loss? So number one, if you've noticed that you put on belly fat or visceral fat, which is fat around the organs, have you noticed that it's increased more in the last 6 months, even though your activity and diet are relatively the same? Number two, are you taking a GLP-1 like Ozempic or Mounjaro or any of the GLP-1s on the market out there? If that's a yes, just mark yes, and you can post your comments below. Number three is, are you looking to put on muscle, and actually are you trying to develop a six-pack? And then the final one, number four, is, have you noticed any cognitive decline in the last month, where you forget people's names, or you have great ideas, but you just can't seem to hang on to them, or you're just not executing. You feel like you're pulled in multiple directions. So tesamorelin, the real way that we will determine if it's the right peptide for you is through doing a comprehensive blood analysis. And in this blood analysis, we'll look at different markers that will show if tesamorelin is the right peptide. One of the things we're going to look at are your liver enzymes. We'll look at ALT, AST, we'll look at GGT. These are all really important markers to see if your liver needs some support. Because in some of the research, what was discovered is that the peptide tesamorelin can actually help with some of the damage to the liver. Now, tesamorelin from the pharmaceutical name is called Agripta, and in Agripta, the dosing is a little bit higher and a little more aggressive than what we're using it for when it comes to health optimization. But if you've got any problems with like a fatty liver disease where your hemoglobin A1C is high, your triglycerides are high, and your liver enzymes are elevated, tesamorelin would be a phenomenal use case for tesamorelin. The other thing that you want to look at when it comes to your lab markers is your IGF-1. And IGF-1 is a really important marker, and I would not get on tesamorelin until you look at this, because that is the big predictor for growth hormone. And IGF-1 levels, if it's anywhere above about a 280 to 300 as a dude, then you want to make sure that you probably will hold off on the tesamorelin. And there's other pathways that you want to optimize first. Tesamorelin, if you're using any kind of growth hormone itself, you don't really want to stack a growth hormone that you're injecting with the peptide like tesamorelin, because you could overexpress the growth hormone pathways, and actually you could do some damage. And so if you have found that, yes, I do want to build muscle, and I've noticed more adiposity or more belly fat lately, or maybe you did a DEXA scan and you found that your visceral fat is increasing, tesamorelin could be phenomenal. If you're looking to build muscle, even though you're on like an IGF-1, and you're wondering, okay, what's the dosing? Well, typically about 1.4 milligrams, 4 to 5 times per week as prescribed by your physician. But then the other thing is, if you just want to get a six-pack and you're trying to like really get some definition, maybe you're a bodybuilder, or you're just getting ready for summer, maybe you've got a lady out of the country that you're going to go visit soon, then tesamorelin can help get you some definition. And then number four is, you just really want to think about cognitively, if there's any impairment, because what they found in the studies is that people who had mild cognitive decline, these were men over 60 in this particular cohort, they found with mild cognitive decline, tesamorelin was actually able to optimize their ability to think, to reason, to focus. And the beautiful thing about it is it activates what's called BDNF. Tesamorelin opens up the gene to create better neuroplasticity. So if you want to go deeper, the best place you can do is watch my next video, where I'm going to talk about all the research and the many benefits of tesamorelin, and I'll see you there.